There are parts of Europe where there's very little virus at the moment, or even no virus, and it would seem to me not to be perhaps absolutely essential from a public health perspective to be denying entry of people who've come from countries where there's very, very little virus. All countries are going to have to be super careful because they want to establish travel, and no country is going to want to think that they are somehow being treated unfairly. So, you know, if Britain starts saying, well, it's 2 weeks quarantine for everybody coming into the country, then I think a lot of other countries are going to say, well, the UK's still got quite a lot of virus, and perhaps we're going to say 2 weeks quarantine for people coming from the UK. Lockdowns are horrible, quite simply. And actually, I have not seen anything anywhere from the World Health Organization that advocates this kind of total movement restriction right across a population. As a phenomenon, the lockdown is awful because of its impact on everything else, its impact on incomes, its impact on food, its impact on education, its impact on accessing other kinds of services. So you're so right that none of us want lockdowns at all. None of us want lockdowns to go on for too long. We all want countries to be sufficiently good at tracking the virus that they can deal with situations at a very local level. And yes, you may need to stop movement in a particular geography, and that's part of good practice. But I think we would never want to see this phenomenon where more than half the world was in lockdown about a month ago, and I think the social and economic, political consequences are going to prove to be really, really serious. If we've got a good vaccine, we need to make sure that everybody can be vaccinated at the same time. It would be really awful if only the rich got the vaccine. And it's got to be a safe vaccine, because there's an awful lot of people in our world today who are very nervous about vaccination. So the last thing we want is an unsafe vaccination. Just I would ask everybody to calm down on the continuous publicity about vaccine here in a few months' time. I think it's very unlikely to happen like that. We've just got to learn to live with this virus. That's what really matters. If we want to try to create an environment which is super safe for our staff, if we're in a bar or in a restaurant, and for our patrons, then we need to stick to 2 meters. If we're prepared to tolerate an increased level of risk, particularly for our staff, then we work on less than 2 meters. So here's my thinking. If you're going into a bar or a restaurant and you really are anticipating that you're going to be closer than 2 meters, you ought to be wearing face protection. And you absolutely ought not to go if you've got any evidence of an upper respiratory infection. Just need one person in that situation to suddenly cause an outbreak, especially if they've got a lot of virus. And always remember, it's not you, the patron, it's the person behind the bar, the person who's clearing the tables. It's not so much about you when you're doing a protest, it's about others who you're in touch with. The bus driver who's running the bus that gets you to the protest, the person who's on the platform of a crowded local train that you're getting into, the person who's cleaning some facility that you're using, or who's serving you in a shop. All the time I'm interested in the people who are in contact with, say, 300 or 400 different people in a day. And ditto the police people who've got to try to keep order. So I've been really trying to get the point across that we're all going to have to learn as members of the human family to be responsible about how we behave. the last thing we can do is to start instructing people in ways that are just completely unacceptable to them. And I was looking at pictures of protests, for example, in the US yesterday, at one particular place where there was an up-close and personal moment between demonstrators and police, a very positive one, by the way, hugging each other. And I saw, to my horror, that there were quite a lot of demonstrators with masks that were not properly covering their faces. They were under their noses, or they were skew with. And I just thought, uh-oh. Whenever there's been an event like this, there's always a detailed forensic analysis to try to find out how things could have been done better, and that's exactly as it should be. Everybody, including myself, will be called to account. That's again as it should be. But it's kind of peculiar that there are world leaders who are saying that they're withdrawing from the only mechanism that exists for all the scientists, all the public health experts to come together to share their experiences. And given that this is the worst public health crisis that I've ever known in my life, and I haven't met anybody else know anything like this, responsible leaders surely should stay engaged. I find it just hard to explain what's going on when looked at from the interests of these billions of people, often in very poor countries, who are totally dependent on the WHO and the wider UN for everything they need. They're dependent on for technical advice, for accessing test kits, for accessing protective equipment. So disappointing and inexplicable, and I very much hope that the people of the world will prevail upon these leaders who are thinking of walking out to say, for the sake of everybody, particularly the poorest people in the world, stay in, and then when the time is right, then ask all the questions you like and call every one of us to account, because that's how it should be. Honestly, the people of the world need the world's national leaders, the world's science leaders, the world's public health leaders to be working together because of the enormity of this problem. And I also think that we're just at the beginning of this. This virus doesn't sweep through populations. It infects a proportion of people. And it's horribly persistent. And I think it's going to go on being a threat. So we're going to have to be in it for the long haul. It's a marathon. It's not a sprint.